Welcome to Fundamentals of Public Health Engineering. Today we will be discussing measles. This video is created by Anne Joseph, Jeanju Paeng, and Mahnoor Waqar. What is measles? Measles is defined as a highly contagious viral infection caused by a single-stranded RNA paramyxovirus. A 3D image of the spherical-shaped measles virus particle can be seen in the picture. Measles is also known as morbilli, rubeola, red measles, and English measles. However, it must not be confused with rubella, which is a different viral disease. Measles is a serious disease and it affects around 20 million people a year. Additionally, it caused 110,000 deaths worldwide in 2017. It is endemic in areas with low vaccination rates, countries such as Madagascar, Philippines, and India, but also has re-emerged in developed countries such as the United States. Historic timeline of measles. Persian physician Rhazes, aged 65 to 925, was the first to give a detailed description of the disease. He published this description in a treatise of smallpox and measles. In it, he also distinguished that smallpox and measles are two different diseases. In 1657, measles first appeared in the United States, in the city of Boston. In the 1950s, there was a major outbreak of measles in the United States where an annual average of more than 500,000 cases and 500 deaths were reported. In 1963, the first vaccine for measles was developed by John Anders and Thomas Peebles. The distribution of the vaccine began in 1968. Before the introduction of the vaccine, over 2 million deaths occurred annually due to measles, but since its introduction, the number of cases and deaths declined. In the year 2000, measles was declared eliminated from the United States as a result of effective vaccination programs.
Once infected, the incubation period lasts between 10 and 14 days. Initial symptoms include fever, cough, runny nose, sore throat, and inflamed eyes, also known as conjunctivitis. After the first few days of these milder symptoms, fever starts to spike and rashes start to develop into large blotches. The start of rashes is the primary indicator of the communicable period of this disease, which lasts for around 8 days, from 4 days before rashes begin to show, and ending after around 4 days of having the rashes. Another more alarming symptom is when the infected experiences tiny white spots with bluish-white centers on the inside of the reddened mouth on the inner lining of the cheek. These are called Koplik's spots.
Complications due to measles. People at risk of complications are depicted by the images on the left-hand side. They include adults over the age of 20, that may be college students and young professionals, pregnant women, immunocompromised individuals such as people with HIV/AIDS, and infants. Measles is not just a rash and it must not be taken lightly. Its mild complications include diarrhea and ear infections. Measles may even result in hearing loss. Some of its severe complications are pneumonia. It is the most common cause of death in infants. Encephalitis. It occurs in 1 in 1,000 people and can cause convulsions and intellectual disability. Fatal brain inflammation. It affects 1 to 2 children out of 10,000.
The disease is airborne, which means it can spread easily through droplets when the infected cough, sneeze, or even breathe around other people. With an extremely high basic reproduction number between 12 and 18, measles is extremely contagious. According to the CDC, an infected individual can infect about 9 of every 10 people he or she contacts. Detection of measles-specific antibodies in serum measles RNA in a respiratory specimen are the most common ways to confirm a measles infection. Serum and throat swab samples are the most common, but as an alternative, nasopharyngeal swabs and urine can also be used. Nowadays, measles is prevented through childhood combination vaccination. The measles, mumps, rubella, or MMR vaccine is administered to children in 2 doses. The first is typically given between 12 and 15 months, and the second between 4 and 6 years. The MMRV vaccine includes the varicella antigen and can be administered to children between 1 and 12 years of age. To give an example of how effective vaccination is, the MMR vaccine's first dose is about 93% effective in preventing measles, and 2 doses are about 97% effective according to the CDC. Other forms of prophylaxis or prevention are post-exposure. An MMR vaccine can be given within 72 hours of exposure, or immunoglobulin within 6 days. They cannot be taken together, else the vaccine loses effectiveness. Each have reasons for use depending on the infected individual's predisposition. There aren't any antiviral therapies for measles. Medical care is given to the infected for symptom relief and treating common complications. However, severe cases can call for the use of vitamin A. The World Health Organization, UNICEF, and CDC all recognize vitamin A as beneficial in terms of reducing morbidity and mortality, especially in developing countries where deficiency is a problem. This is because it is known to help with preserving epithelial cells and immune modulation.
Even children in communities that welcome immunization are now at risk of missing out on the measles vaccine because of the COVID-19 pandemic. This is an unintended consequence of the fight against coronavirus, as 24 countries have delayed measles immunization campaigns, and more developing countries will delay vaccine drives as the virus reaches larger swaths of the global population. Cultural and religious hesitation to vaccination is causing a preventative disease like measles to make a comeback in the U.S. We're starting to see the highest number of cases in the States since 1992 because of pockets of vaccine-hesitant communities. Hotspots include Orthodox Jewish communities where travelers coming back from Israel have spread the disease to unvaccinated peers. The Pacific Northwest also shows a cultural resistance to vaccines. In fact, a recent study by the National Conference of State Legislatures found one county in Idaho in which a third of kindergartners were not immunized, and 7 more Idaho counties with some of the highest opt-out rates among the western states. Measles is completely preventable, and this is why we cannot reverse progress. We must continue immunization drives and combat vaccine hesitancy trends in the developed world. Doctors must use strategies of compassion and shared values to push parents to vaccinate their children against this horrible disease. Measles immunization is a matter of strength in numbers, so we must all work together to protect the immunocompromised and vulnerable among us and reverse the trajectory of returning to pre-vaccine era levels of susceptibility.